Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Now coming into the pathological part, or how do you differentiate PCOD from PCOS pathologically? What system is running inside so that we are developing this disease? As you can see here, this is polycystic ovaries. So in PCOD, what happens is whenever you are having bad lifestyle, by bad lifestyle I mean continuous form of stress, lot of tension for your exams, or for whatever reason you're feeling stress, and then you're having improper sleep, you're sleeping after 12 p.m. That is also a problem. If you're having less than 6 hours of sleep, or just 6 hours of sleep is not enough for people in reproductive age, so 9 hours of sleep is important. And even if you're taking 9 hours of sleep, that is you're sleeping at 12 o'clock and you're getting up at 9, that is also not considered proper sleep, because for hormones to get proper balance, you need, or your body needs, 10 o'clock to 1 o'clock sleep. That is very important. It is called hormonal repairing time. So if someone who is sleeping at 9:30 getting up at 6:37, I think they are much more healthier and will live for a longer period of time compared to people who sleep less and are sleeping after 12 or at 12 o'clock. So due to these lifestyle changes, if you're eating a lot of unhealthy food, packed foods, you're not working out, you're having stress, this causes hormonal imbalance, and this hormonal imbalance might be the main problem, where the follicles become immature and they become cystic in nature. This is PCOD's pathology. Let us dive into PCOS pathology. As you can see here, I will be discussing PCOS pathology. I will be drawing a chart wherein you can understand how differently this PCOS runs and how it is affecting different systems. Now coming into the cycle of PCOS. See, we do not know what causes or what happens or what is the exact cause of it, but all we know that this is brain, if you can see here, and in brain we have two parts, which is hypothalamus and the pituitary part. So the hypothalamus secretes a hormone called as GnRH, which will trigger the anterior pituitary gland. The anterior pituitary gland will be producing two hormones, which is luteinizing hormone and the follicular stimulating hormone. These hormones are responsible for follicle formation, and every time this is released, the follicles are formed. 6 to 12 follicles are formed. In that, one follicle will become egg and the others will disintegrate. After the release of the egg, the follicle will start to seize and it will become corpus luteum, which will release progesterone. This is the physiological aspect. But what happens, we do not know why and what happened. The GnRH is increased in this aspect here. Whenever there is increase in GnRH, the luteinizing hormone also increases, but the FSH can decrease. And this luteinizing hormone will trigger the ovaries which are present here. And this ovaries will not mature. The follicles in the ovaries will not mature, and the follicles will become immature and they will become cystic, and they will be anovulatory cycle. That is, there is no mature. When the follicles mature itself, you will have the release of egg, right? So here what is happening, the luteinizing hormone is affecting the ovaries, the theca cells in the ovaries and the stromal cells. Because there is no FSH or very little FSH, what happens, the follicles which are formed or which are triggered by this LH are not maturing. Whenever there is no maturing, there is no release of egg. So it is anovulatory in nature, that is, no egg is released. So there will be fertility issues here. And apart from that, whenever there is no egg release, that means whenever there is no maturation, when the egg is not released, there is no corpus luteum also, right? Whenever there is no corpus luteum, what did we say? There will be no progesterone coming out of corpus luteum. So there can be, because they are immaturely produced or immature in nature, E2 is a little less, but E1 is triggered by this LH, which is produced. These both are estrogens, right? But this is estradiol, which is important, the estrogen that we tell. This is E1, which is produced inside the fat cells. So this E1 is increased. Apart from that, this luteinizing hormone will trigger the ovaries to make androgens. This androgens will cause growth of mustache, side locks, male pattern baldness, hair on the chest and other things. And remember that we have this cycle which is of 30 days, right? So first day of menstruation, 14th day of menstruation, and then we have the 30th day of menstruation. Okay, or 30th day of the menstrual cycle. Here we will see estrogen surge when there are follicles, and then drop of estrogen, and progesterone surge when the corpus luteum. this corpus luteum is not forming in the PCOS. So whenever there is no corpus luteum, what will happen? The progesterone will decrease, right? This progesterone usually has an effect on the GnRH hormone. That is, whenever progesterone is released properly, GnRH will be in control. There is GnRH increase, then there is no progesterone to control it also. So this cycle will start running like this continuously. So in PCOS, we will be having irregular periods, we will be having polycystic ovaries, and also we will be having excess androgen, that is hyperandrogenism. Even if you are having any of these 2 high categories, that is P for polycystic, I for irregular, and E for excess androgen, any of the 2 also, you can come under PCOS if you are having differences in your LH as well as FSH. If you see PCOD, you will not be having much of difference in all of this. You will be having difference only in your estrogen and progesterone. But if you see PCOS, you will be having hyperluteinizing hormone, low FSH level, low progesterone level, hyper E1 level, and moderate E2 level. So all of these things are disrupted in your PCOS. Apart from that, this PCOS will have other features that, like it can cause diabetes mellitus, it can cause a sugar rush in the body, it can cause drop of sugar in the body. So all of this will be discussing in the next part. Okay. If you're someone who's suffering from PCOD or PCOS, you can contact us in person. If you're staying nearby the nearest branch of Fidicus, or if you're staying abroad, or if you're staying very far from us, you can contact us online either through an audio or a video consultation option. And after the consultation has been done, we will ask you for investigations, whatever your case demands. And after the investigations, we will be after all this process is done, especially to the online clients, your medicine will be door delivered to you. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying in apart from USA and India, anywhere else in the globe, 4 to 8 business days. If you're someone who is looking for cure, you can contact us on this number. You can call us, message us, or WhatsApp us on this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here, if you're someone who's suffering from PCOD or PCOS or any other female reproductive symptoms, why should you choose Fidicus Homeopathy? We have already discussed why should you choose homeopathy over allopathic form of treatment. Now we will be telling you why should you choose Fidicus Homeopathy apart from all the homeopathic physicians in the world. Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. We are doing this video because we have high success rate in treating PCOD, PCOS, bulky uterus, endometriosis, adenomyosis, fibroid cases, and much more other cases. Here we follow 3 principles. High success rate. We are already having or experiencing good success rate in people who are suffering from PCOD and PCOS. And apart from that, transparent treatment. That is, there is no gray area between the patient and the doctor. Here we will be explaining it to you clearly what the prognosis and how your case is going to run. And the personal care here at Fidicus is top notch. The reason why we are doing this video is because we care about our patients. They are asking us a lot of questions about these topics. So that is why, in order to educate them, we are doing this video. So the personal care here at Fidicus is top notch. We will be answering all of your queries and educating you on your disease. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.